Hi, everybody. Hope everybody's doing well in their placement and life itself. This week, I decided to talk about reflective practice and conflict. Just a reminder, my placement is at an outpatient mental health clinic. Currently, I'm working with clients who have substance abuse and criminal background. So I'm going to actually choose one client in particular that I'm going to discuss there seems to be conflict between service providers, case managers. Not major, but it's rising to the surface and it's noticeable. A client, he's in his early 50s, I believe, chronic alcoholic. I think I discussed him and mentioned him before in my previous videos. So chronic alcoholic, homeless, have history of like severe brain injury, and is in and out of the sobering center. He's already suspended from our center because of his behavior. So I meet him outside of the center almost daily to check in with him to see how he's doing and provide his daily allowance just to make sure he's eating and taking care of himself. We're for sure making note on the incidents where he's having new physical injuries. Sometimes it's noticeable on his face. One time it was all over his face, over his nose, across. It's so sad. And actually, right now, he's in the emergency department. He's in the emergency room for a fall that he had. So I don't know what it is that's making him go. It's his alcohol that's causes him to fall and out of control. But we managed his money, so I don't know where he's getting the alcohol. He probably knows people around the neighborhood, and they give him a sip or two. I'm not too sure, and it's really difficult because, especially working with other service providers with different views and different goals. I've talked to the client. He disclosed that he's depressed, and he drinks to numb his pain, numb his physical pains actually, because he fell. One time he fell last year, based on records in his report, that he fell so hard that he broke his spine. So he has physical pain on and off, and sometimes it's unbearable. I could only imagine. So my goal is to help him get treated and see his primary care doctor. But another service provider who's at the sobering center is focused on his alcoholism. Now, that's fine because I know that is an issue, but no matter how many, it's like it's all related. But it's very difficult to work with somebody who's not seeing eye to eye. I just want to work together. But the focus for him, the other service provider, is alcohol, making sure the client detox. Mind you, the client has been in detox for a few days at a time, and he comes out because he wants to drink. So, or he doesn't want to stop. So it's very difficult when the client is not on board. So what do? Use reflective practice, go over the scenario, utilize your supervisor, talk about it. I think about what goes on. I talk to the client himself, and it's like I tell him too. This is the reality of it. My services are available, but at the same time, he needs to put his best foot forward. And I told him I don't judge you. Be honest as much as possible so I could help you meet where you're at to help you move forward. And I asked him, do you want to be better? Do you want to have a better life? Because if not, there's all of this is useless, pointless. And I tell him our services are voluntary. In order for us to help him, he needs to allow us to help him, you know? So my question is, has anybody faced conflict within the placement with another coworker or other service providers, and how to best deal with it, especially when it's the client's treatment on the line? All right, thanks everybody. Have a good one.